Have you been trying for pregnancy for months or even years? Have you ever paused to check your medications? Do you know that your medications can be hindering your chances of conception, including prescribed medications? In this video, I'm going to be breaking down 9 medications that can affect your chances of conception. And not just that, I'm going to be offering you solutions of what you can do or an alternative that you can use instead in order to maximize your fertility each month. I will advise you to watch this video to the end because some of the medications I'll be mentioning here might surprise you. Hello my friends, welcome to today's video. My name is Pharmacist Ngozi, and if you are new here, if you're a new subscriber, thank you, I see you. And for my old subscribers, thank you so much. Welcome to today's video. Friends, in this video, I'll be talking about 9 medications that can affect your fertility. And by that, I mean the ones that can stop ovulation from occurring, the ones that can stop sperm from moving, the one that can cause low sperm count, the one that can cause dryness of the vagina, which means the sperm won't be able to swim. These are the things I'll be discussing. But apart from that, I'll also be giving some recommendations, that is some alternative or some things that you can do instead of using those medications at that particular time. Let's look at them together. Number 1 in our list is antibiotics. Antibiotics are necessary to tackle some infections, and most times we don't have any other alternative except to use them. It is recommended that before one starts trying for pregnancy, one is supposed to be as an optimum health, not just because of your sake as a person, but because of the sake of the unborn child. Antibiotics like aminoglycosides, nitrofurantoin can actually interfere with sperm production. So what it means is that if you're a man, you have to finish these antibiotics before you start trying. For women, antibiotics can cause interference in the pH of the vagina, leading to yeast infection. An example is broad-spectrum antibiotics like ampicillin, amoxicillin, augmentin, etc. Now, I will advise anybody who wants to use antibiotics to try to get multivitamins and be taking just to help you boost up your immunity. And apart from that, women should also try to be using probiotics, because probiotics has good bacteria that will help to normalize the pH of the vagina, therefore preventing the yeast infection that would have occurred. Again, things like fresh onions, fresh garlic, fresh ginger can actually also help you. So you can add them to your drink, including lemon. These are good and they can boost your immunity too. Number 2 in our list is antidepressants. Example of antidepressants are paroxetine, fluoxetine, etc. People take these medications when they go into severe depression. The effect of this medication on a male is reduced sperm production, reduced sperm motility, reduced libido, and reduced sperm count. For women, it causes reduced mucus production, increase in prolactin, and interfere with hormone balance. So these are effects of this antidepressant on both male and female. There are supplements that you can take that can boost your mood, depending on the severity of the case. Omega-369 is one of them. Research has proven that omega-369 can actually improve your mood. Another one is high B vitamins. You can also be on high B vitamins to also help with your mood. Apart from taking these supplements, there are some lifestyle changes one can adopt. One of them is exercise. Exercise helps to increase your serotonin level and boost your mood. And also, taking nature walk is also one of them. Number 3 in our list is antihistamines like loratadine, cetirizine. This can interfere with the female mucus production, and you don't need anything that will dry up your mucus during the time of ovulation. Therefore, if you're on these medications and you're nearing your time of ovulation, it's advised that you stop them so that they don't affect your mucus production. Friends, number 4 in our list is anti-inflammatories like ibuprofen, diclofenac, ketoprofen. All these anti-inflammatory, known as NSAIDs, we use for pain. They can actually affect our fertility. They can stop ovulation from occurring. They can cause what we call luteinizing or ruptured follicle syndrome, which is a situation where the follicle will grow but it does not release the egg. And we know that when egg is not released from the follicle, there is no egg for the sperm to fertilize, even if the sperm is present there in the uterus. So that is why you have to avoid usage of this medication, especially during this period, because some people, when the ovulation is coming, they keep having pain and they want to use some pain relievers. It's advised to use paracetamol instead, because paracetamol will not affect your ovulation. but these ones can actually affect your ovulation. Therefore, you avoid them during this period. But it's also noteworthy to know that some of these adverse effects are reversible, so they don't occur forever. But the point is that if you miss that particular ovulation because the egg couldn't be released at that time, you miss the chance of probably conceiving that particular period or that particular month. So that's why it's important that you avoid anything that could lead to that. There are some natural pain relievers. One of them is omega-3s, like omega-3, 6, 9, or omega-3 fish oil. They are anti-inflammatory. You can use them, you can use turmeric, or you can use ginger. These are called natural painkillers, and you can use them as an alternative instead of these ones that can affect your ovulation. Friends, number 5 in our list is clomiphene. Most women are familiar with clomiphene. It is used to treat infertility of PCOS and other infertility cases. But the point is that it also has some side effects that can also affect you, especially if you are not taking it based on prescription. One of them is that it can lower your estrogen level, and it can also decrease your mucus production, that is causing vaginal dryness, and you don't need that, especially the time you are trying for a baby. Research has shown that it can generally decrease the rate of conception, and for the fact that it can decrease your estrogen level and mucus production, it means it can lower your chances of conception. Because clomiphene is anti-estrogenic, research has shown that it causes this endometrial lining thinning. What it means is that if endometrium becomes thin, implantation becomes difficult. Therefore, this is also one of the adverse effects of using clomiphene, especially using it unprescribed. Again, clomiphene can also cause ovarian hyperstimulation, which is swelling of the ovaries, which can be very, very painful. Some women actually buy clomiphene unprescribed because they want to stimulate their ovulation or because they want to have multiple births. Truly, it can do that, but it's supposed to be under medical supervision to avoid the side effects. You may ask, what's the option if you don't take clomiphene? There are some natural treatments for fertility or to boost ovulation or to boost your fertility that I've already discussed in one of my videos. So you can go through my videos and you will find them and you watch, and that will help you learn the natural way that you can manage or boost your fertility instead of using something that might harm you later on. Number 6 in our list, friends, are medications for cold. These are medications that contain pseudoephedrine or phenylephrine. These medications cause drying of mucus. Of course, that's why you use them, because you're having running nose and so on. They cause dryness of that mucus, but they are not selective. If you use them at the time of ovulation, they can also cause vaginal dryness, that is, prevent mucus production of the body, because if the vagina is dry, the sperm can't be able to swim. If you're having cold, you don't take this kind of medications when you are ovulating, so you can look for natural options that boost your immunity, like taking vitamin C and other supplements. Number 7 in our list is high blood pressure medications like calcium channel blockers. Research has shown that this can also affect your fertility by causing low sperm count, erectile and ejaculatory dysfunction, reduced sperm motility, and in females causing increased prolactin and suppression of ovulation. Example is amlodipine, nifedipine. It is. If you're a couple trying for pregnancy and one of you is suffering from high blood pressure, it is recommended that you meet your doctor so that the doctor can look at your drugs and remove the one that is likely to affect your fertility. Again, you can adopt lifestyle changes like exercising at least 30 minutes every day. You can also change your diet by increasing your intake of vegetable and fruits and omega-3s. And very important also is managing your stress level. Number 8 in our list is drug for migraine like glutamine. This drug can cause reduced blood flow to the uterus or reproductive organs. Therefore, you are not advised to use them during the time of ovulation because they can prevent implantation or they can even lead to miscarriage because of their vasoconstrictive and ototoxic properties. The way you can manage migraine is by finding the triggers, what usually trigger migraine for you, and also finding the root cause of it. Sometimes it could be hormonal imbalance, and it's advised that you treat the hormonal imbalance so that you will be predisposed to having migraine all the time. Number 9, which is the last but not the least, is ulcer medications like omeprazole, cimetidine, esomeprazole, etc. They can lower sperm count and motility for the men, and they can also reduce sperm quality. For women, some research has shown that they can cause increase in prolactin. The good news, friends, is that the effects of these medications are reversible. That means if you stop using them, you won't be getting some of these side effects again. So if you're already using some of these medications, you don't need to panic. All you need is to do some adjustment and some changes so that they don't affect your chances of conception. And on this note, I've come to the end of today's video, and I hope I talked to someone. I hope someone learned something. And if my video is actually adding value to you, please subscribe. Don't just watch. Subscribe, like, and share so that your friends and other people who need to see this video can also see them. Until my next video, thank you so much for watching, friends, and bye.